Welcome to Truth and Wellness, where we're committed to uncovering the real strategies behind lasting health transformations. I'm your host, Pavel Gray, and today I'm thrilled to introduce our guest, Dr. Kent, a doctor of pharmacy and glutathione expert who's devoted his career to health optimization.
Today, we are tackling a critical issue that touches millions of people. Inflammation. It impacts everything from pain and disease to the aging process itself. My guest today is Dr. Kent. He's here to shed light on why inflammation often spirals out of control and how we can effectively stop it at the cellular level. Dr. Kent, welcome.
Thank you for having me, Pavel. Inflammation is perhaps the most misunderstood health issue in our time. People generally accept it as a normal part of life, but it really shouldn't be.
So, what exactly is inflammation? Because, like you said, many people think it's just a normal part of aging or being human.
Right. Inflammation can be thought of as your immune system's response to damage or perceived threats to your body. When you cut your finger, for example, inflammation rapidly rushes in to heal the wound and fight off any potential infection. That's acute inflammation, and it's actually quite beneficial. In contrast, chronic inflammation is like having your immune system's alarm ringing 24/7. Your body starts to attack its own tissues, which is where you see issues like arthritis, autoimmune diseases, heart disease, diabetes, and it even speeds up the aging process.
That's a scary thought. What leads to inflammation becoming chronic?
Great question. Think of inflammation like a fire. Acute inflammation is a controlled burn, but chronic inflammation is like a wildfire that just won't go out. If your cells can't clear the damage fast enough, the fire of inflammation keeps burning. One critical player in this situation is glutathione. When your glutathione levels are sufficient, your body can extinguish those inflammatory fires quickly. But when glutathione is depleted, these fires continue to rage, consequently spreading inflammation throughout the body.
I see many clients who struggle with chronic pain and joint issues, and they often rely on anti-inflammatory medications. Are those helping them or making things worse?
It's a bit of both, actually. Anti-inflammatory drugs like ibuprofen may provide short-term relief from inflammation, but they don't really address the root cause. Additionally, they can further deplete glutathione levels, as your liver uses glutathione to break down these medications. So, while people might feel better temporarily, in the long run, they could be making their situation worse. It's a vicious cycle.
That sounds frustrating. So what alternatives do we have?
One of the best alternatives is to address cellular glutathione levels directly. Research published in the Journal of Nutritional Oncology showed that supplementing with glutathione precursors can lower inflammatory cytokines like TNF-alpha, which is a major inflammatory signal in the body. So, as we boost glutathione levels, inflammation naturally decreases because your cells can effectively clear damage.
How long does it typically take for people to see results with glutathione optimization?
Most individuals notice a reduction in pain and stiffness within about 4 to 6 weeks. If you look at inflammation markers in blood tests, you can expect those to improve typically around the 12-week mark. However, this timeline can depend significantly on how depleted an individual's glutathione levels are at the start. Severe chronic inflammation may take longer to resolve as there's more damage that needs to be cleared, but I've seen remarkable improvements even in people who have dealt with inflammation for decades, often within 90 days.
You mentioned cytokines earlier. Can you explain what they are?
Absolutely. Cytokines are those little chemical messengers that immune cells use to talk to each other. Some cytokines can trigger inflammation, while others can help reduce it. When glutathione levels drop, pro-inflammatory cytokines take over. We end up with an increase in inflammatory signals, which then creates this feedback loop where inflammation depletes glutathione and low glutathione in turn increases inflammation. Unless we intervene, this cycle just perpetuates.
So, what's the key to breaking this cycle?
The best way to break that cycle is by flooding your system with bonded cysteine. This is the building block your cells need to rebuild their glutathione reserves. As your glutathione levels rise, they can start to clear out those inflammatory signals. The cycle then starts to reverse. Pro-inflammatory cytokines decrease, and anti-inflammatory signals increase, bringing your body back into balance. This has been proven in various peer-reviewed studies coming out of reputable institutions like McGill University and the University of Denver.
That sounds promising. I practice yoga regularly, which is often cited as an anti-inflammatory practice. Does yoga help in managing inflammation?
Absolutely. Yoga can be highly effective. Movement, breathwork, and stress reduction are all vital as they can lower inflammation levels. However, it's important to note that you cannot simply stretch or breathe your way out of glutathione depletion. Those practices are great for reducing demand on your system, but if your cells lack the biochemical tools to clear inflammation effectively, you're really fighting with one hand tied behind your back. Combining yoga with glutathione optimization delivers the best results.
What about diet? It seems like there are so many anti-inflammatory diets out there today.
Diet definitely plays a role. Consuming processed foods, sugar, and trans fats can elevate inflammation levels. On the flip side, whole foods, omega-3 fatty acids, and a diet rich in vegetables help to reduce it. However, even the most ideal diet is unlikely to completely counteract the age-related decline of glutathione. After the age of 40, the production enzymes for glutathione decrease by nearly half, so supplementation becomes essential for reaching optimal levels. Think of diet as your defense, while optimizing glutathione is your offensive strategy. You really need both to achieve victory over inflammation.
I'm sure my clients will want specifics. What should they take and in what amounts?
Most adults over 40 can benefit from taking 2 sachets of Immunocol daily. This provides a sufficient amount of bonded cysteine to significantly raise intracellular glutathione levels. For those suffering from severe chronic inflammation, I would recommend up to 4 sachets daily for the first 90 days. After that, maintenance dosage typically would be 2 sachets a day, depending on factors like stress levels and lifestyle factors.
And this is safe to take even if folks are on other medications?
Yes. Immunocol is a food product and is bioidentical to what your body naturally produces from dietary protein. It's generally safe to combine with most medications. However, anyone on medication should discuss supplementation with their healthcare provider first. Some cancer treatments are designed to deplete glutathione in cancer cells, so timing of supplementation matters in those cases. Still, for the majority of people, there are no contraindications.
Dr. Ken, this has been eye-opening. It's alarming to think that inflammation has become so commonplace that many people consider it normal, but it doesn't have to be that way.
Exactly, Pavel. Pain, stiffness, and chronic inflammation are all symptoms of cellular dysfunction. If we can address that root cause, those symptoms often resolve naturally. That's what true healing is all about. I will also include a link for a 5-day sample kit of the original Immunocol and booster for people that want to get a feel for the taste and practice mixing the product before they commit to a monthly supply in the description section of this podcast.
Thanks for tuning in to the Truth in Wellness podcast, where your journey to mastering wellness begins.